One of the things we want to talk about at the very end of this class is, again, we're focusing on you as an administrator, not so much the entire entity, because it's sort of how you interact with the administration and with people who work with and for you, and with patients. And one of the things that you have to keep in mind are all those ideas that we talked about, like autonomy, non-malfeasance, beneficence, trust, justice, privacy. Those are sort of what I would like to think of as a framework in which you can question, does this action mean this? Will this have an impact on this? So there's sort of a framework, a scaffolding of ethical values that you want to bring to your work site, but also that you want to judge your actions on. But another thing that I want to talk about is some questions. And again, some of this is, how do I give you, or how do you have language, or that you use language to help people understand and to rethink what they're doing and to rethink the process? And some of what we see sometimes in this whole thing is people using the wrong language or asking the wrong questions. So some questions that I want you to think about whenever there's an issue or whenever you have someone who's sort of not getting it, and something you might want to ask yourself too, or when there's a new activity or a new technology or a patient issue. And one of the first questions you want to ask yourself or you want to ask others is, what and what? Wait and what? And that's sort of a clarifying question. So you're saying, okay, we have this much that costs this much. Wait, what is happening here? Why are our costs so high? Or why are we getting such sick people in? We're not getting the impact and the results we want. A doctor wants to do a certain procedure or doesn't want to do a training, then you can say, wait, what? And that gives the other person an opportunity to explain to you why they're doing what they're doing or how they perceive what they're doing. And again, some of these questions are so you understand what others are saying or doing from their perspective. And it's a way sort of to slow the process down. The next question you want to ask yourself and ask others specifically is, I wonder if, or I wonder why. So I wonder if we do this technology, what will happen? Or I wonder why patients are coming in sicker. So it's sort of, again, questions that you can use to ask yourself and to ask others who are part of the process. And you'll probably get different answers from different people in and through the process. And the next thing is, when you've got so much disagreement, then one of the best questions is, couldn't we at least agree? So couldn't we at least agree that we want healthier patients? Or couldn't we at least agree that patients are what we should focus on? This is really good when you've got some rogue individual who thinks they're right, they're wrong, or they are saying, you can't do this because it means I won't have enough patients that pay, or I won't have enough money coming in, or I'm having too many sick patients and I can't make money, so I don't want to be part of this process. It's a really good way to sort of make a leveling ground. And one of the things that you always want to do, because this is supposed to be about patients, is couch that sort of statement in, couldn't we at least agree that we want the best care for patients? Couldn't we at least agree that we want patients to be the center of this? And again, those values of, couldn't we at least agree that we want patients to have autonomy? How do we get to there? Couldn't we at least agree that we want patients and what we do to not hurt them but to help them? Couldn't we at least agree that we want this to be a just system? So again, it's sort of giving that level playing ground just by asking that question. But again, asking these questions, you've got to wait for the response. And then one of the most important questions, again, that helps people get unstuck is, how can I help? And why you ask it that way as opposed to what can I do is it sort of makes them sort of prioritize what's important to them. And this is especially true with patients, and especially something you want to make sure that you do with patients, because how can I help might be different depending on where they are, what skills they have, how they feel about the system. And the same could be for employees. How can I help? That sort of stops it and sort of says, what do you want me to do, without saying, what do you want me to do? And it also shows that you are not coming out with an edict of, this is what we do to solve everything, because then you sort of take that power away from the individual, and you also get less buy-in whenever you sort of swoop down and solve everything. How can I help? After you've sort of said, well, we at least agree on this, is a really good way for people to have buy-in, because they say, well, if you did this, things would be better. Again, it opens that dialogue. And it also gives them ownership over the solution, and it makes them prioritize. And then it also helps you see what they see as the most important thing. But one of the things that you want questioned that overarches all of this, and again, it sort of comes back to, can't we at least? and it's sort of another way to get to that, is what truly matters. So what truly matters in the system? Is it having patients get better and enabling them to take better care of themselves? Is it making money? Is it getting patients through in a timely fashion? So you need to sort of stop, ask yourself what truly matters. Okay, so it's wait, what? And this is sort of a way to stop all the conflict or to stop people who are sort of in your face and have them clarify the issue. And then the next question you want to ask is, I wonder if, or I wonder why. So it's sort of saying, I wonder if we do this, what we'll get, or I wonder why that's happening. And again, it's engaging individuals in this conversation with you, not you talking to them or them screaming at you or you saying, well, you just don't understand because you're part of the administration. And then couldn't we all at least agree on this? And again, this is where those values come in that we keep talking about, that scaffolding, those frameworks. Couldn't we all agree that we want patients to be able to have an autonomous decision making and give consent? And this process may or may not do that. Couldn't we at least agree that we want to not hurt, but help people? And how do we get to there, right? So how can I help with that happening if this is what we all agree on? And then sort of the overarching thing is you want to say what truly matters. So if you've read a loggerhead, what truly matters, and again, you can come back to these scaffolding of values that we talked about. Autonomy, privacy, non-malfeasance, benevolence, and justice, and trust. Part of what this kind of conversation does is it builds up that trust between patient and healthcare provider, but also between all the people who work in your hospital and all the people who are working with you and in auxiliary places. It's also making sure that the patient is the center, and it's a really good way to diffuse whilst building up and building towards a solution that everybody has buy-in. So I really want you to think about that and try to use those questions in situations and examples and see how that goes. You can use it in your life, but it's specifically a really good way to use it as being an administrator, no matter where you're administrating, whether it be a huge practice, a hospital, a specific department in the hospital, patient care, even if you're a third-party payer like Blue Cross Blue Shield. It's a really good way to sort of problem solve and to move the entire organization together whilst including everybody in the solution, which is what you want to do. And again, if you do these things and you can sort of not blunt conflict, but you can use conflict to make a better organization, then you are getting toward that patient-centered care and you are getting towards that evidence-based medicine that you can implement, and you are getting towards your money and your mission will match and you're not at odds with each other.